sa scrotal area, scrotal sac.
Pyronidal does not go there. I'm just wondering why they say pyronidal. It does not go to the scrotum. I'm sorry. I'm trying to understand all of this. That's why I need to see the pathology report of your scrotal sac.
Sige, hanapin ko na lang dito. Sa ano, meron kasi ako yung entire file eh.
Hanapin ko lang dito.
Initrato dilabo rin.
Okay, just to put that clear, pyronidal dito sa likod. Not the scrotum, okay? So, no pyronidal. That cannot be a pyronidal. Okay,
Okay, sige.
Let's take that out. It will just confuse people, you know?
Google ko lang pathology
No. But you have our fistulas. Okay, from what I see, okay, now,
Okay,
I was explaining yung kaibahan ng piksa at fistula sa piksa Pilipino. Lahat ng may nana, piksa yan. Pero yung piksa sa kilikili, pag pumutok, gumagaling. Ng kusa. Yung piksa sa puwet, hindi gumagaling many times kasi may connection sa loob ng puwet. And when you have a connection between the anus to the skin, that's called a fistula. And kaya hindi gumagaling yan kasi yung mikrobyo sa puwet ay iba na mas matindi. So the usual fistulas happen the majority of fistulas happen because nagka-infection or nagkapigsa sa puwet, nagkapigsa sa anal gland na parang tigyawan pero sa puwet nangyari. But there are some complicated fistulas that are caused by problems with the intestines, kaya yung colonoscopy importante. And if you say your colonoscopy is normal, then baka hindi yan ang isang cause, no? Now, there are other causes of fistula. But from what I see, based on yung kwento mo, na may mga butas, na may lumalabas, that looks like a fistula. And there are some fistulas that happen under the balls. There's still fistula. So, I'm not sure what they removed
here
in the scrotum. But if you had seen me first, I would have thought that was related to the fistula. Not separate from the scrotum because I have seen a lot of fistulas under the balls. But I want to see the...
Ito yung pathology. Sebaceous yata yung final
No.
Mali ba?
Okay. You put it all together. If they say sebaceous cyst...
Diagnosis, spermatocyl versus sebaceous excision.
What is the pathology report?
Hindi ba ito pathology report? Under pathology, surgical pathology? Hindi, iba yan.
It's a diagnosis.
Tell me how to find the terms.
Epidermal inclusion cyst. Okay. These epidermal inclusion cysts are mga cysts ng skin. Mga kita mo, no? But number one, they're not as common under the scrotum. Okay. Number two, they're not related to the scrotum, to the balls, the testes, no? They're not related to the urinary tract. Because if they were, that's what the pathologist would say. It's part of the urinary tract, the ball. So it looks like it's skin. But I will tell you, if I see a patient with fistulas, and then meron sa balls, or I suspect, kasama yan sa fistula. Okay? It's related to fistula. So, if you ask me, parang yung sa balls noon is part of the process of the fistula. Okay? Now, having said that, okay, naoperahan ka in 2015, 2018, nakaka-fistula ka all the time. Okay? And then, umulit rin under the balls. So, mukhang it's the same pattern. They're all connected. Okay? So, what do I see now? I see fistulas, but I see that it's been very complicated. Medyo matikas na sa paligid, and it attacks both sides. Honestly, when I get an MRI, I ask the MRI to be done by my own radiology kasi I look at it. I look at the tracts kasi ang issue ng fistula is may connection sa loob ng puwet. And you have to find that opening. You have to know kung iisa lang yan o dalawa o tatlo. But you need to understand how it's related to the anus. So you need to see yung tract, no? And sometimes the radiologists are not looking at it that way. Pangalawa, we're also looking at the tract in relation to the muscles of the anus. Kasi yung muscles ng anus, importante sa control. Kamusta naman ang pagdumi mo?
Okay
Nakokontrol mo
naman,
naman.
oo.
Okay. And then third, minsan may mga areas na may nanang hindi nakakalabas. So we need to plan out paano maipalabas yan. So you have a complicated fistula. It would be nice if the MRI tells me that. And,
Actually, doctor, I have a thought. Tanggalin mo natin yung keyboard. Ito kasing mouse lang kailangan eh.
sige.
Makukuha ko na.
Okay. Now, the other thing is, medyo matigas yung nasa ilalim ng ball. So I don't know if this is because nagalaw na, no? Or but I have when a fistula is
Okay, kaya dito. Ito yung MRI gusto mo or yung PET scan?
no, I wanted your MRI PET scan hindi pa natin alam. Your PET scan is your PET scan is not significant. Doesn't really say anything about malignancy here. Inflammation but hindi pa sure eh.
Okay.
We need that tissue diagnosis. Okay, pag matagal na pag very complicated na yung fistula, nagkakaroon ng changes, no? And it can be very big inflammation. But unfortunately, it can also become malignant. So that's what I need to check on you. I'm not sure why it's so
Ba't pa parang walang nagulog, no?
Oo nga. Alam mo, yun ang problema namin talaga pag iba-ibang laboratory. We cannot really load the image.
Pero ito ibang source eh. Kailangan yata open yung file ko.
Where's your file?
Autoran. Or you just open this DICOM image. Kasi dati autoran lang, nagbubukas na eh. Ito yung mga images ko.
Yun ba?
Pero they don't know how to open. You have to use the autorun. Kaya lang.
Yeah, I know. That's always the problem with... Did you see it before in your own...
Yeah. Pakibalik lang dito, doctor. Sa DVD. Sorry. Click on DVD. Sige. Sige. Autorun application ulit. Autorun application. Okay. Ayaw nga talaga, no?
Ayaw.
Hindi na pala nga. Pero dito, lalo Romeo.
Oo nga, bakit ganun?
Dapat, sana, hindi yan.
Ay, baka lang yun.
Replace. Anyway,
Why don't you leave it with me? I will study it
okay,
in
sige.
in my laptop.
sige.
At home.
Sige. Okay, sige, sorry, doctor. Okay, yeah.
Alright, so this is what I know. So, the MRI sees it, no? I need to study it well. It looks like a complex fistula, but there's some parang mass formation. And they say in relation pa to the penis. No? I have to double check that because that's not common. Now, here's the thing. So, fistula, for me, I always deal with difficult fistulas. And if this is one of those difficult fistulas, that's okay. I'm open. I'm prepared for that. And usually, what we will do is operate and remove what hard ones we do and drain it. Aceton is possible if it's a very difficult fistula, but we make the decision during surgery. No? The thing though is because medyo matigas, no? Part of that management should be a biopsy to find out kung ano talaga itong matigas na ito. And the PET scan is inconclusive. It doesn't really say kasi it could be inflammatory. Ganun rin, iilaw rin siya. What we need is tissue diagnosis. So what I would do with you is under anesthesia, I will examine you. I will check the fistulas. I'll also see if I can, that's why I'll study the MRI, if I can remove all that hard mass under your scrotum and submit that to pathology, or if it's not going to be feasible to remove it at that time, I will take a biopsy of that mass to see what it's like. We need to make sure, we have to decide whether it's malignant or not malignant. Iba yung management kasi. That's what I would do with you. I would evaluate you under anesthesia, the fistula, and either remove or do a biopsy. But before I do that, I will study the MRI again with my own eyes. No, hindi lang report. Okay, that's what I will do with you.
Doctor, may question po. When you do the biopsy po, do you cut it into 4 quadrants and then take a different part, or how is it?
Okay, so I study first the MRI.
Okay.
Okay? Kasi it's complex eh. May matigas dito sa kaliwa mo, meron matigas rin sa kanan. Yung matigas na yan, pwedeng inflammation lang yan. But anyway, sometimes we might have to take biopsies on both those sides, just to be sure. But the big one, definitely. And the big one, I have to decide again, can I completely remove it para we have the whole, no? Or sometimes when we cannot, we just stick needles into it and submit those to pathology. It's called core needle biopsy. We have to decide based on the way it looks during the... So, maraming bites yan. But it's not 4 quadrant, it depends on the mass. So it will be in the big mass here and the little one on the other side.
Doctor, question na another.
Doctor, can I just try the computer while you do it?
So, Doctor, excuse me, kunyari
Kasi if not,
itong
I will
mass,
just
no?
repeat
Is it possible that yung part of the biopsy that you got there, hindi pala malignant, tapos yung ibang part to sa mass? Is it possible?
That's always possible. That's why when we plan out these biopsies, we try to get as much a representation as possible. So if I feel there's any suspicious area, I will biopsy that. I will say it. So
so sa tingin nyo lang makilala mo na ay ito medyo pangit to.
Yeah, hindi lang basta-basta. We really make sure pag nandyan na, na lahat na kailangan ma-biopsy, iba-biopsy para walang question sa resulta. Kasi minsan pwedeng ganun eh.
Yes.
Iba yung resulta kasi hindi mo lang na-bite yung...
Yes.
Yung,
Doctor, another question. How, kasi may narinig po kami na sinasabi nila minsan na ni-biopsy mo, tapos malignancy, lalo mo pong kinalat, something like that. Is that
That's not
possible?
true.
That's not true.
Yung nagsasabing ganyan, kaya lang nila nasabi yan is because kumakalat na. By the time na biopsy na,
So no
kumalat
such thing.
that is not a concern. The concern really is what is this. And if we do not biopsy it, we will not know what it is. No? And our worst fear is if it's a malignancy, we will not be able to treat it until we get a biopsy of its malignancy. A PET scan does not tell us whether it's malignant right now or not. Okay? Because it's only there. Pag sinabi ng PET scan na maraming kumalat dito sa iba-ibang part ng katawan, then we will assume, okay, you have a malignancy that spread. Probably this one.
But if it's very focal na SI, it's not conclusive.
It does not, right now the PET scan does not really say it's malignant. It just says it's lighting up. It could be inflammatory or malignant. You really need a biopsy to prove it. You know?
So kung sakali po, Doctor, pag ganon, ano yun, bali, overnight siya muna?
Yeah, pwedeng overnight, no? Ako, I would, if I cannot see the MRI, I'll repeat the MRI.
Okay.
Doctor, mga ganun. Ano kailangan mong bilhin?
Ay. Bakit yung MRI?
Ha? Hindi, meron pang iba.
No, this is that's not
So how soon can we get another
well, you
MRI?
see, I'm leaving for my Christmas break on Saturday.
Wala.
So, and I will be back January 2. So, if you want to do this, we should do this either Wednesday, Thursday, or Friday.
Ang MRI?
The biopsies.
The biopsy?
Yeah, already.
So paano, hindi naman tayo magre-repeat ng MRI?
Well, we can repeat it at the same time na namatid siya. We can do the MRI the day before, and then do the procedure the next day.
I just don't know which image to
Yeah, I
load.
know.
I can load all of them, but
This is
Hindi,
not
pero
what I
ano na,
wanted.
kasi medyo time of essence na rin.
no, I'm hearing it while I'm
Yeah.
doing it, so I
So
understand
this is
it.
not what I need. I need to see the.
That's why I was trying to load the MRI so you can see.
Yeah, this is not the one I need to see. I need to see the.
The thing that was gonna know.
Yeah, and all the other.
Yes po, hello, sorry.
Tanungin mo please kung ultrasound guided ba or just a naked eye biopsy.
Doctor, Is it ultrasound guided po in biopsy?
There's no need because the mass is so obvious.
There's no need of because
It's
the
right
mass
there
is,
in your front of your eyes.
the mass is very obvious na daw. Okay.
It's just, I'm sure it's in,
So kunyari Doc, kung sakaling ginawang biopsy, how many days po ang recovery?
Mabilis lang yung recovery niyan. Give it a week, but usually a few days lang yan. The biopsy results will be out in another week siguro. Lalo na kung medyo mahirap ang if the pathologist it's not easy to assess.
Yeah.
They will pass it around among themselves. So that might take 1 to 2 weeks kung sakali. Tama for Christmas vacation.
So pero kung sakaling ganon, pero by that time na kung may results na tayo, nakabalik na kayo. Pero importante sana nga before you leave.
Yeah, because we
Yes,
we
yes.
know. You know, this thing has been there a while.
Yes.
Months na. So a few weeks won't make a difference. It's just that we need to know what it is.
Yes po. Opo. Pero so far sa mga ganun po, Doctor, as you said, this is a very complex one, no? Is that very common or?
I see a lot of complicated fistulas. I just did one last night. But I have,
Sandali.
but most of them are not malignant.
Aha.
I've seen very few that are malignant, but I've seen them also. So that's the first thing we need to know.
Okay. Sorry, sige, ano
Doctor, do
question?
you think mine could be malignant?
I cannot say because it's hard eh. I
Ano
have to bias
question?
it really.
Okay, sino? Doctor, may question din Benson.
Yes.
Benson, brother ko. Opo.
Yes,
Kailangan ba magawa ng this such as fistulogram, right? Fistulogram, right? Do you need to do that to plan your surgery? Does it inject a dye to the
I don't do that.
fistula?
I used to do that when I was younger. I don't need to do that anymore. What I do is I use the MRI, sometimes the ultrasound to guide me. And during surgery, I inject also with hydrogen peroxide. It all guides me. So the fistulogram I hardly do anymore.
Okay.
It's an old technology.
Okay.
Doctor, do you use robotic for this or?
Not for the biopsy. And not even for, it depends on what we find out. If it's usually fistula surgery, you don't need robotics. You just need experience and an expert eye if they're hard. They can be very, there's a recurrence rate with fistulas that even with the best hands, there's a 15% recurrence rate. So, you know, we plan it out very well. But
Okay.
I need to know exactly what this is before we move it.
Doctor, another question. Are there any other tests aside from the biopsy? Parang kumbaga,
Well, you even need, at his age, cardiac clearance. We'll have a cardiology clearing na kasi the anesthesia, the anesthesiologist will want to have cardiac
Okay.
clearance.
you have someone here?
Yeah, we have.
Wala
So
problema.
we would admit him the day before, get the cardiac clearance, and then do the procedure. Probably get an MRI again if I'm not satisfied with the
okay.
MRI.
How about po, Doc? Any other blood tumor markers or something?
We don't need tumor markers until we have a biopsy.
Ganun.
Useless to
You
get the
don't-
tumor.
you don't-
And you already got them. The CA is not
Very not
high.
conducive.
So what we need is a really good
Really
tissue sample.
Tissue sample, okay. So if ever po, when is the earliest date?
And then when did you have your colonoscopy?
2023 meron, 2024 meron din. I'll get the results from, I got it
I
from
might just do a
corneal
short scope just to
Ah,
check the
okay.
rectum and then just
So corneal
yung may
perspective.
kasama yun sa procedure.
Okay. So, Doc, just a question now. Kasi we will have to decide, no? Just a question now. When is the earliest date na pwede po? Kung sakasakali ko na free.
That's be before I leave.
Yeah.
And I will
Today
leaving
is-
on Saturday.
Yeah, today's 15.
I have a procedure tomorrow. Wednesday would be the earliest that we do it.
Wednesday. So, ang check-in niya,
Tomorrow.
Tuesday.
Tomorrow.
Kung
It can
sakali.
also be,
May fasting ba needed?
yeah, just for the anesthesia.
Just
And
starting
then
today.
may enemas, no? No, the fasting is a few hours before. We can do this on Thursday. We can do it on Thursday.
Thursday.
Doctor, you were in New York before, no?
Yeah, Memorial Sloan, yeah.
Memorial Sloan, right?
Yeah.
Mm.
That's where I learned in an ultrasound for it the best, but it's not around anymore. Douglas Wong.
Ah,
Yeah.
Good luck, sir. Any other questions pa kayo?
was asking if, remember, we will maybe we can get some extra slides so
Before.
to keep it.
Oh yeah, you can keep the slides.
Okay.
Of course, you can get the slide. The important thing is to make sure that what the biopsies we get represent the whole.
Yes po.
So that's what I will make sure of, because I
Okay.
need to make sure. The first thing I want to make sure is this is not malignant. So I have to make all the bites just to make sure, because the treatment is different. Okay. But I'll probably
Yes, about
repeat the MRI.
Repeat the MRI.
After the biopsy, is the surgery stage different stages or just one big surgery for everything or?
It depends on the biopsy.
depends on the biopsy daw kasi iba yung management sa malignant at saka benign.
But since the biopsy will take 4
Let's
days,
say
we will
benign,
not
just one
do
single
anything
surgery.
on that.
So we will wait for the biopsy results.
Very quickly.
Doctor, question po. If it's benign, so can the surgery be done on one ano lang?
Yeah. It will be carefully planned. We will during the surgery we'll be looking for all the tracts. We will be draining them. We will look for the internal opening in the anus. I have to see, it depends on the kind of internal opening, whether they're one or two. So we try as much as possible to do it in one stage, but sometimes they're so complicated. Sometimes they require stage procedure. We put a seat on and we do it again. And then the techniques differ. There are we call the lift technique or the flap technique.
Yeah,
It
I was
really
gonna ask
it
that.
really depends on the location of the internal opening, and having, even if you do it in one stage, the data is, including my own data, and I have a lot of patients to show, 85% success, 15% recurrence. So what we do when we do our surgery is we also make sure that the muscles are protected, because if the patient needs additional procedures, we don't injure the muscles anymore, kasi the muscles need to be protected. Secondly, we try to make the procedure in a way that if it recurs in an area where it's easier to reoperate on. No, yung hindi malayo. Right now, you've got it all over the place. That's not easy to operate on also. So we try to find a way na kung magre-recur dito, magre-recur yan para mas madali yung reoperation.
Is it always safer to do a loose seton first if I have the time? No.
It depends.
Depends.
It's not always safer. If it's unnecessary, you're just subjecting the patient to 1 or 2 more procedures when it could be done in one sitting. It really depends on the difficulty of the. There are some you shouldn't operate first. You put a seton first, let it drain out, and then you do the definite procedure. In your case, I can't say. It's already complex, but it's already draining out, so I'm not sure if a seton will be necessary for you. We decide during surgery.
Excuse me, Doctor. Philip, may question ka.
Yes.
Doctor, kailangan po ba ng may urology backup ba? Hindi na.
Usually fistulas, when they involve the scrotum, don't involve the testis. So usually hindi kailangan, but that's why I want to review the MRI. Kasi usually bihira na i-involve yung urinary tract. Kaya my honest opinion, that surgery done by the urologist before, that was part of the fistula already. That's why you're still seeing this.
Kaya lang yung MR did not see it yet, no?
Hindi na-address.
Yun na nga, sabi ko parang...
But you saw a colorectal before that.
Yes, and the colorectal said, diagnostically, clinically, he saw a healed fistula. But for some reason, the MRI did not show it.
Yeah,
Tapos-
but okay, so he saw a fistula.
Yeah.
And then you have this scrotal mass. I would have thought, okay, this is an extension of the fistula.
Right.
Because that's how they go. They really involve part of the scrotum when the internal opening is on.
Medyo neglectful yata na yung
Hindi lang experience siguro.
hindi experience.
Excuse me,
He hasn't seen as many difficult fistulas as I have.
Doctor, one more question. Ang approach ninyo, naka-prone ng pasyente o naka-supine?
My personal technique is lateral decubitus, naka-sideways. I can do it lithotomy. I can do it prone. So either one, but I find it easier for the patient. The anesthesiologist is always happier when the patient is on his back. They're not happy when the patient is prone. They like it when the patient's on the side, and I can operate on the side. So most of the time, I just put the patient on the side. It doesn't cause a problem to me. So there's a very big chance he will be on his side.
Doctor,
But that's my own technique. Many other colorectals like either lithotomy or prone.
Doctor, another question. Parang inisip ko just not to waste time, no? Why can't we have an MRI now or something, you know? Pwede ba yun? Kasi
Well,
yung MRI niya, tatry mo pa pag-aralan. Eh baka hindi ka pa
like ganito lang.
Sabi nga niya, most likely he will repeat it.
Yeah, most likely.
But you cannot do it now? Or like
No, because if he's going to be admitted on Wednesday
Thursday,
morning,
okay, sige.
early morning or Tuesday evening if you want, we'll schedule the MRI also.
Okay.
We'll need to do a blood test lang, yung creatinine niya ulit, di ba, to check the MRI. And then may cardiac clearance rin.
Okay. So ano pa, may question pa kayo?
So Irene, ang sabi niya, needs another MRI?
Yo, ayaw niya. Kasi he wants, meron siyang pinapakita, meron siyang gusto makita eh. Which baka mukhang hindi yata na ng focus na itong
Well,
MRI.
it's not sure kasi we cannot see the images right now. Even though I brought the images, for some reason it won't work.
And you know, when I request for an MRI, this is what I always say. Pelvic MRI with special focus and tangential cuts to the anus, anal fistula protocol. That's to tell the radiologist, this is what I'm looking for. If I just put a pelvic MRI kasi they're not looking at
What
the fistula.
I did with my pelvic MRI with
Hindi
two
very
contrasts,
specific kasi
ID
yung
and
MRI.
rectum.
Well, kasama yun,
For
I
siya,
know,
gusto
but
niya very focused.
you have to tell the radiologist, this is what you're looking for.
Okay. Sige. So,
And then I look at it myself.
Yeah.
I look at I don't rely on the report. No?
Right.
Kasi radiologists are not experts on fistulas.
In short, he cannot really say much as far as confidence about this, right? Can he say how confident he can do this?
not yet. I mean, you know, how yung approach ko pa paano kasi hindi pa niya talaga ma-conclude because yung MRI gusto talaga niya makita.
This is what I'll tell you. I don't like what I feel, ng matigas. It needs a biopsy. So if you ask me what needs to be done, it's the biopsy.
Biopsy talaga.
And then once the biopsy results are in,
That's a
then we can decide what is the best approach afterwards.
Apo.
And it's completely different if it's malignant. If it's not malignant, there's a different approach. But this is a complicated, we call it a complex fistula. So we will plan out as a complex fistula.
Okay.
Doctor,
I have done a lot
when
of
you say I
complex
don't like what I feel, you mean like you felt malignant one and you felt benign ones?
It's too hard to feel the benign ones. So I have to make sure it's not malignant. Of course, without a tissue diagnosis, I cannot
Apo.
say with certainty. I have to get the biopsy first.
Okay.
Does he think that it can be highly possible malignant or not?
Yeah, he just said that he did not like the way it felt. He said it felt too hard to be benign.
But I will also say I've had.
But then he said of course he still needs.
I have seen, and this is when in my PGH days when you have a lot of neglected fistulas.
Okay.
I've seen really bad ones that look like this also. That's why I won't say it's malignant until I get the biopsy. Okay.
You've seen bad ones or benign ones?
Bad ones that
bad
are
ones.
benign but are not yet malignant, but they look bad also
Okay.
because they're of the neglect. That's why it's hard to say until you get the biopsy.
So doctor, this is the first time I've had like 2 months of this parang itong bleeding and stuff. Usually
That's just an infection. That's purulent. Just let it out.
it's possible. It's not because of malignant. Or we don't know.
We don't know. We have to buy it. But a fistula is really like that. It has discharge.
Okay, yeah. I guess, yeah.
Okay, so kailan biopsy? Are it 2 days? 2 days from now?
The earliest is Thursday, no?
Wednesday.
Wednesday.
Well, Wednesday
No, you get
admission.
admitted. If you want, get admitted Tuesday night so we can do the MRI.
So far Wednesday you're free pa? Your schedule, your stuff.
Well, Thursday I'm free. Wednesday I have surgery on Wednesday, but Thursday I have a short procedure. I can do him on Thursday.
So you cannot do on Wednesday, bale?
Wednesday I can do it, but we have to admit him
No, may
Tomorrow.
MRI. because he admits me Tuesday night, then you have to prepare MRI. I have to
Plus the
fast.
clearance,
I
plus
have
the
to fast
clearance.
for the MRI. So
Plus the clearance, and then we do the procedure on Wednesday.
right.
On Thursday. On Thursday.
Kasi
So
we need,
talaga
I need
Thursday.
fasting pa, minsan 24 hours.
Yeah.
So
of
talaga
fasting.
Thursday ang schedule kung sakasakali, pero Tuesday
Yeah.
ang admission.
Yeah.
Okay. Ano?
Quick question.
Sorry. Sorry, ano question? Doctor.
Yes.
Question lang po do you know yung increased uptake ng PET scan, is that correlated to that heart mass?
Well, yeah, the increased uptake, but that can happen whether it's inflammation or a malignancy. So we still do not know whether it's malignant. We need a biopsy. Because if it's just inflammation, that's what the PET scan is also showing.
But doctor, have you seen inflammation at 17 level? Bihira.
Yeah, I've also seen that. Even they are not saying.
Yeah, right.
Even they are saying it could be inflammatory.
Right.
Yeah, so the PET scan doesn't. The only good thing about the PET scan, because this is expected to see in a PET scan, if it's inflammatory or malignant, that's what you're seeing. The only good thing about the PET scan is it's not showing elsewhere.
Yeah.
That's what the PET scan is showing.
Okay. Then, so may question ka pa?
So in-house ng MRI niya, right? So
Dito.
napitas siya din MRI.
Kasi hospital to eh. So, lahat ng dito.
Doctor, you want me to leave the USB drive with the secretary? The
Yeah,
contents.
Leave it. Yeah. Leave it
But
to
I
them.
still need the USB drive back. But I can
Okay,
transfer to a hard drive somewhere if you want.
Yeah. Okay.
You want me to start
No, I'll just look at the MRI na lang on my own.
the
new one?
new one na lang?
Yeah.
Because we have to repeat anyway, right?
Yeah.
One last question.
One last question po. Sorry, Doc. Okay.
Doctor, when you say lateral position po, GS pa rin ba or spinal block?
Usually pag fistula, spinal ako. Because you can,
Spinal block.
when I do my hemorrhoid procedures and my other procedure, the ANOT, it's usually local anesthesia plus sedation. Because I can predict what needs to be anesthetized. So very easy for patients. But for fistulas, because they go all over the place, it's not easy to put local anesthesia. So we usually do a spinal block.
Okay.
Okay. Hindi na po kailangan endotracheal.
Usually, hindi na kailangan. Hindi kailangan.
Okay.
Just sedation if ever, to put the patient to sleep.
Okay.
IV.
Okay. Sige. Ano pa? Wala na?
Okay.
Okay, so far, okay. Mag-discuss na kayo. Thank you so much, Doc.
Alright,
Thank
okay.
you, Doc.
Salamat po, Doctor.
Salamat, Doctor. Thank you very much.
Thank you very much, Doc.
May Viber.
Opo.
I will leave you my number. Kasi I use a special admission form.
Ah.
It's not here on the I will vibrate to you later.
Okay, sige po.
This is my number.
Sige.
You text me with your Viber, I will send it to you.
Apo.
Yung admitting orders, ha?
Plus 6391.
Okay.
Okay.
Thank you po.
Okay, so...
Doctor, it will be here, no?
Yeah, it will be here.
Tapos, Doctor,
I don't go anywhere else anymore. I'm
Doctor,
taking care of this
hindi,
hospital.
no offense lang, just mga magkano ba have to prepare ko sa gali?
Just a biopsy, pathology report, flexi.
Round off lang more or less, yung package.
With the MRI, mga 60, 70. Okay.
Okay.
Tapos may PhilHealth na nababawasan. May PhilHealth na kayo.
Ay, siya, baka wala.
Bakit wala?
Kasi, taga-US siya eh.
Okay.
Oo.
Taga-US ka pala. Don't have insurance.
I do have insurance in the US.
Oh, but not here.
Here, I do not.
I don't know.
I mean, I can call
I
them.
don't know.
May PWD daw siya.
Dito?
May dito. Kasi ay malaki.
Balik
So,
bayan
may
ako.
you have PWD here?
Yes, apo.
Balik bayan.
Okay na, that is
You
my
can
discount.
use a PWD.
Okay.
Tapos, okay, so... Doctor, medyo masama ang feeling mo.
No, I cannot tell. All I know is it's a complicated fistula.
Yeah.
And when I see a complicated fistula, and I've seen many before, in this particular, I always have to think, is this a fistula that has become a malignancy? And so we biopsy.
So, doctor, if it were
How many?
2015, it's about 10 years. Right? If
Yeah.
it's 2018, about 17.
See, that's the thing. Very rare reports of fistulas becoming malignant when they're there for too long. 10 years or more.
Very what?
When they're there for too long,
Yeah.
when they've not been addressed for too long, there are reports of malignant degeneration. So you're there, you're within a renal. So that's why
Hard to tell.
it's hard. There's a possibility.
Right.
I have to biopsy it well to know.
So sa tingin mo yung 2016 follow-up sonogram na hindi nakadetect ng fistula, mali yan?
If you're not looking
Properly.
kasi you need the expert eyes.
Okay.
Most people don't know that when some fistulas reach the scrotum.
Mm-hmm.
Ako, when I see it scrotum, alam ko na because I've seen it so many times.
Mm-hmm.
But some people don't.
Mm-hmm.
And they go to urologists. That's not new to me. I've seen that before.
So, bali yung colorectal surgeon ko sa 2015, medyo baka not experienced enough, no?
Yeah, to see. He probably did not see a lot of these complicated fistulas. But I'll tell you, if I knew you had a fistula and then suddenly you have a scrotal mass, I'll first start thinking, this is part of the fistula.
And how did I get that cryptoglandular fistula in the first place? Was it like
Well,
probably
well-
from my constipation or from my
Well, most of the time, it's just like getting a pimple.
It really
just happens,
Even
yeah.
anal, ah?
Yeah, because the
Kala ko anal is quite rare, no?
anus has glands.
Oh, anal glands, kala ko quite rare, right?
No.
Mine is anal glands, di ba?
Well, yeah, but now we have to see if there's a malignancy.
Right.
Because then it's a different type of fistula altogether.
But just doctor, just to ano lang, yung family namin talaga pigsahin lahat.
Sa puwet.
Marami, yes.
Siguro
Ako personally may puwet, may
Out of 10
kilikili.
kami, no?
Kilikili, iba sa puwet.
Out of 10 kami, 7 kami, marami.
Yeah.
And then
Pero iba-
recently may mama, may natkuha sa kanya na isang ano, pigsa na parang nag-heal. Paano
Sa
siyang,
Kasi
yes,
yung iba yung
parang
sa
ganun
puwet
na
kasi
siya.
you have to rule out a fistula.
Ah,
Pero sa kilikili, pag pumutok, gagaling na yan. It's just that pwedeng mangyari ulit.
Dok, hindi eh, minsan nandiyan pa yata yung ulo.
Yung may cyst.
Parang,
yes,
yeah.
doctor, parang hydronitis kami kasi bumabalik eh.
Yeah. Okay, that's another thing. Is it hydradenitis? That's another
This is,
issue.
this is not high HS.
You know, it's got an appearance that could look like hydradenitis, but it's a little more in the front. Hydradenitis, but it's also possible there. That's why I wanted to get a biopsy. Hydradenitis is, the surgery for hydradenitis is different than a
Yes.
fistula
Ah,
because there's no connection to the anus.
ah.
And then we take out everything.
Pero parang akin, hydronitis, tapos nag-connect na to
I have to
anus.
check.
Oh.
I have to check. But certainly it's not pilonidal. Pilonidal is up here. It
Right.
only stays there.
Ah.
It doesn't go that way. So, yeah, it could be hydradenitis, but
Kasi
Hindi ba biopsy?
ako meron eh. Sa singit ko I did eh.
yeah.
Pero
it's also
natanggal
possible.
na siya, malinis na siya.
That's also
Kasi yun na nga
possible.
tuloy-tuloy siya na parang wala na, may parang ayaw mag-heal and then may lumalabas na sa ng tubig.
You know, I would, for you, I would consider it good news if it is a fistula or hydradenitis, or fistula with hydradenitis. The wounds will be big. It's going to be almost
The whole.
disfiguring in a way.
Kailangan ba
Pero when
plastic
they
surgeon?
heal, they heal.
Kailangan ba plastic surgeon? Hindi naman.
Well, pwede, but it depends. When it's infected, we don't call a plastic yet. We wait for it to heal. But I've seen the biggest of hydradenitis, tinanggal ko, talagang ang laki ng defect. Pero when they heal well eh. So sometimes I don't call the plastic anymore, I just let them heal. The thing though is, yun nga, you need to make sure it's not a malignancy.
Okay.
Okay. Thank you po, doctor.
Alright, okay.
Thank you so much,
Okay,
Doc.
Mike.
We learned a lot from you.
Yeah.
Pwede mo yung report.
Ha?
Yeah, you
Oh,
will.
sige, sige.
So text me and then remind me about
Is that the Viper, no?
Oo. Alin dito yung ito? Mga questions ito. Questions ko dito. Right? Ito. Ito sa kanya na yan. Ha?
Yeah.
Ah.
Okay, so text me later so I'll send the report, huh?
Apo, apo.
And then you talk it over among yourselves.
Apo, apo.
Okay, I sent you a message na. Hello. Hello.
Okay.
Hello, doctor.
I'll send it later. I'll type it out.
Where are you going, doctor?
I'm going to Mindoro because my son is there.
Okay. When are you back?
January 2.
Okay. Okay. Doctor, if there are any follow-up complications, there will be a follow-up doctor that I
Yeah. I'll have somebody with you.
Okay. Sige, thank you, doctor.
Thank you so much, Ado.
Alright.
We appreciate
Thank you, doctor.
In fact, the one relieving me will also be there so she can see. Further.
Okay.
Okay.
Alright, thank
May
you.
naiwan pa? Okay, thank you so much.
Thank you, doctor. Okay. Chile. Yeah, it was. Bali, pinaka-kilo.
Diba yung essential? Essential.
Ano po yung advice ni Doc Rami po?
Ano po,
Nagbigay siya ng request?
Hindi, kasi sabi niya actually, may siya suggestion, baka suggestion niya is kung talagang tutuloy namin yung biopsy. So magiging baka bukas ang admission, then may mga clearance, then baka Thursday ang
Bukas gabi admission siguro. Tapos baka Thursday,
ang
he will
gagawin
do
na
biopsy.
biopsy.
Okay. May binigay na si Doc na admitting orders?
Wala pa po. May gagawin daw sa sarili daw admission.
He gave me his Viber
Yung
number,
Viber niya sa
and
akin.
I had to message him.
Oo.
Ay,
Dito na isi-send kasi may ibang special ano daw
Parang
siya.
meron siyang admission.
May ibang order, ay may ibang bilin si Doc.
Oo.
Sige, okay.
Dali, bayaran mo na namin po sa
Dito na lang po, pero kapag-notes pa kasi si Doc. Magtatapusin lang
So, hintayin namin?
Yes po,
Okay.
dito na lang po. Tapos si cashier na lang po.
Bayad mo na kami.
Ngayon, meron akong USB drive.
Bayaran
Try
ko.
namin kanina i-open.
Bayaran ko na siya.
Pwede mo ba i-copy sa isang ano? Or wala?
Hindi po
Hindi?
eh, kasi
Okay.
wala po kami na.
Okay. Sige.
Ano man, tatapusin lang ni Doc yung notes niya.
So, hindi pa pwede magbayad?
Opo, mamaya.
Okay. Okay. Sige. Sakit kilihan. Okay, ayos.
Ito siguro rule out. Brutal testan.
Pero may siguro, ito naman, kasi lang pag-realize. Sige, hopefully, the nice thing is hopeful.
Oh,
Napotong pa lang, actually daw. Napotong pa lang. Yung number, no?
Rehab na lang ano.
Ay, ano lang eh? Sino? Saan yung
Ha? Sige.
nasigwa? Ay, nasigwa. Okay.
Wachi group call Benson kaya pilit.
Kaya
Ha? Tiya pa ba in? Walang kaya kung may bayad. Okay, kung may bayad.
okay po.
Philip yan. Hello? Saan ko nga? Hindi siya, kung siya.
Lalabas ako na sa hospital.
Hindi ko magaw, ba't ko? Hindi ko na juga
像唔知什么，就唔知个大也买出个，唔知了。pero那就怎样做了，pero 以前 sloan catering 叫没有啊，已经没有了呢哈。以前不最ASEAN 呢 head surgeon 叫 Harvard 已经好。伊讲这不多我colorectal 无 experience 了。伊讲也上来看到起啊，到 scrotum 就是 fistula 了。Because MRI 講叫伊啊 particular 到叫伊 radiologist 看到從上 MRI 講伊動搖到伊要看伊隻伊 video 叫又咪個 procedure 到伊講伊將因幾個 cuts 到安尼佢係安尼個。你感覺對阿邊？你講話嚇？我唔是於是阿第一吧，唔是。看到上邊，看到上邊伊咧講伊看伊個哦，伊感覺就無啥水咧個 feel。哦，pero伊講伊不多 PGH 個我哋較 neglect， 我哋較 neglected 嘅哦，是變做安尼到啦，無 malignant 到啦。Granuloma 唔是派哦。perineal TB 哦，就是佢哋講嘅。這個人出比王老嘅 experience 哦。較濟係哦，佢王老三八係無夠擺三八嗬。就嚇？我看有啊吼，這個我就計超，我看有過60歲咯，吼，有啊，一個看有60歲咯，有啊，有60歲咯。好。Sloan 叫Mayo 叫尤其 Harvard 呢，pero 佢這個計看是 surgical leadership，ita 做用嘅 Philippine Society of Surgeons head ba kaya yung ASEAN eh. Pero ito naman tayo sumiisip mo yun. Pero kung lisyo, ito si Zaya nga bitong siya na. Pero bigok na siya, ito si Boyshan yaw nga, ito si Guay 2015, bigok kayo nga. Ito si nga eh. Pero ito si lisyo, na si metastase, si Piang, kwa, kisute, si Bikwa. Gọi gồm dạy là tôi xíu xíu là xíu quá khi lại được tao sẽ lo nào nghe người ta stay sẽ làm gì còn điều khi bị cốc lo là therapy mình có điều quạ đeo chơi lo làm gì quạ đeo toa chả quạ chơi lo tao khi bị cốc lo hả bố hắn ăn gì ba 我看有迄搭敢若无去新加坡咯吼，敢若无迄吧？Ini si PT ang nga Mount Elizabeth. Na si cancer ay di sila kong si. Ah.就時間落嗰啲拍緊衝嚟，啲叫嗌人講即係啲你講嘅，係咪？你問 Philip 你 suggest 嘅？
Saya aku pengen ni. Oh, nanti tu si biopsi. Biopsi tu apa tesa tu apa? Napai lu tu tu shumpa tu. Mesti kena buat lagi apa? Biopsi sa ko sa lo man. Ansi.
Goli ko. Mtale pero ina bigay kwat lo ki. Chiko agam si ko na bin. Biopsi within hours isa ang resulta na Jose be kwat lo nga.
Ay ko ba?
Oh, di bote hali lo kong ba? Sa may sugo mo.
Iko na biopsi shito na Jose.
Kui hours bola to sigo di bote hali ko mong ba? Wa kay record. Oh. Bo kasi kung biopsi within hours itay nga lo na Jose na benign ikay tuloy lo na pikwa si Boa. Wam chay ko tama mong idi kam si kala ko di biopsi ko tan ditle kung bo ko chay nga lo kui chay bo kung hours ta pre kung isin chay nga to daw la na benign no ikay kwa lo ha. Bola ko mo ko ta what put mong iki question na. Nating wakay kwabay wali tak mikya te tung wakay record ko sama record ko kay play by li pretty sure kung ani kung mo otet pet mong ingay kasi kung di biopsi di ko nang sandit pa mo di bitong tang bo na biopsi na benign within hours ko ibo kong hours na pero ko swing chay nga lo ko kay ko lo ay kung ani san saya ho Erin okay ho就是現在最終咁樣衝上咁我呢係第二樣呢就掛得美國咁冇俾緊啲快樂阿爸嘅藥咁杯啊咁樣皮咁樣呢我可以 verify by 你嘅 assumption 我可以有這個兩個天可以 verify 看美國嘅 anyway 나한 곳에 회기 미국 되는 거 되죠. 단체야. 오케이, 일단 네가 이건 제일.
Buhay lang yung gelo mga. Ang 이게 샤워요. 그치. Sinikon mo siya.
Ha?
Sir, okay na sir. 找出时间了也动作多的等你多了，这我懂这样。 Meron pa nung may consult ako. Gumatsak yan. Yan sa design ko.
Bakalan na kay book sila at to cancel na lang. Boy admittance na siya. Nakhaming yung cancel. Pero kung sa punto yung sunod din, kaya lang kung tayo sabi ki admit ki jazz, admit ki BBC lang. Ha? Bola unless munroy sabi ka ako sure. Kung may decide kung ano biti munroy sabi ko.
Balik ko lang po.
Thank you po. Pang-decide ko yung sige.
Mga na tutyo munroy kung decide kung sabi munroy sabi ko ay si. Kung chiko nan chiko最白比munroy experience, kasi chiko kibiko pa eh. Munroy yan chiko kibiko.
Opo, puto mo na pala. Basta
Basta nalo ko ay biography lang.
basta definitely na sige ka. Pero sige.
Chiko nan chiko zaya ka.
Na sige walang siya.
Confident to.
Ibuya ka mo.
Chiko nan chiko boya. 도같이 토이 컴퓨터 빠. 아하. 이게 무슨 오퍼레이션 봐 siguro? 이게 sina biopsy lang. kaya pa to. Yata ili tsaw ilo sige hospital. Ang chule kasi kung iba-iba. 이게 검사예요. 하? diallo ba? Okay. Ilang balitan nyo? Okay. Okay.
May kapangyot siya.
Ha?
Kapangyot siya. Pa-CR lang.
Oo.
Kasi bukay na kasi yung cellphone. Kasi bukay na. Liya kasi yung
So, di ko sabihin?
pag-bukay na. Hello? Hello? Bakit? Sige, bigyan mo. Gawa ka isang pa. Hindi, pareho na, pare sa opisina. Sa guardia, ha? May na CRC. CRC. May number ko dito. Yung try number.
Uwa. Pero kit lang kayo sa kayo kasi yabang ni answer.
Ito ba iba pa pwede?
Ito ma'am sa OPT. Wait lang.
Pwede na rin pagkawag ko.